I'm talking about sort of the immediate before the surgery and in the first weeks after the surgery. What is the top advice you can give them in terms of the things that they can do to help you? So in the short term, what is on them to do to give themselves the best chance of success?
In the short term rather than in the long term?
In the short term, yeah.
Okay. This is actually, the short-term benefits are really quite procedural. First of all, don't get yourself worked up. Get yourself into the right frame of mind. You've made a decision based on a long journey that you've been through. If there was another option available to you that was viable for you, you would have taken it. So don't come into the surgery super anxious about it. Leave your anxiety at the door. You've already done that. Okay. Let me at this stage take over your anxiety and look after you when you're in the hospital. Number one. Secondly, if you're having a problem, don't hide it. Tell me about it. I don't expect you to ring me every 20 minutes about every little update and bowel motion you've had. Okay, that's okay if you want to, but I do want to know about what's going on. I want to know. And just like if you go to a hotel and you've had a bad experience, they say, tell us about it before you go. Don't leave us a bad review. Akin to that, let me know about it while you're here. So not because I'm worried about a review, but if there's something I need to do, I want to know about it while you're here. So communicate with me. The nurses will be available. Any surgeon, not just me, will always want to know what their inpatients are going through and what they're doing. And they will be available for them. So when I have an inpatient, for example, my phone is always near me. I will always be able to answer it when the nurses ring me, and I'll know what's going on. So leave your anxiety at the door and communicate with us clearly. Don't be overly anxious about things. You'll usually be absolutely just fine. And then the other things are, if you've been asked to have a shower with chlorhexidine, do that before you come in. You follow the starving instructions or the non-nail by mouth instructions properly. Don't have milky coffee on the morning of your surgery. You can have a black coffee. Don't have a milky coffee. That's one way of delaying your surgery. And in the short term, that's probably all I need from you.
Super.